Hello, Chapter 2, Workforce Safety and Wellness. Talk a little bit about infectious diseases. Infectious diseases are caused by organisms within the body, and these communicable diseases can be spread from person to person, from one species to another, and these infection risks can be minimized by immunizations, protective techniques, and good frequent hand washing. Some routes of transmission includes direct contact with blood, indirect contact such as needle sticks, airborne transmission, sneezing, coughing, vector-borne transmission from fleas or ticks, and then there's also foodborne transmission, eating contaminated food. As an EMT, you're going to be trained handling bloodborne pathogens. These are all developed by the CDC. They've developed what is now called standard precautions, which is a new word for what we used to call BSI, body substance isolation. And you must have good hand hygiene, gloves, gown, mask, eye protection, face shield. You need to know how to properly get rid of soiled patient care equipment. You need to know about environmental controls, the textiles and laundry, how to get rid of needles and other sharp objects, patient resuscitation, and respiratory hygiene and cough etiquette. Cough etiquette's coughing into the crook of your arm. Now, a lot of people are wearing masks. The simplest, most yet effective way to control disease transmission is wash your hands before and after patient contact. If you don't have any running water, use the waterless hand washing substitute. Most of the ambulance will have foam of some sort, or you may have a bottle of hand sanitizer in your pocket. Use it and use it frequently. Gloves. You should wear gloves anytime you're dealing with a patient, because you want to decrease the possibility of exposure to blood and body fluids. Sweat is a body fluid. Think of it as if it's wet, red, white, yellow, brown, pink. If it's a fluid and it doesn't belong to you, it's infectious. Removing gloves, there's a special way to remove gloves, but to avoid contaminating yourself with materials from which the gloves have protected you, there is a special way of taking those gloves off, where you grab the wristlet of one glove, pull it over the glove, the fully gloved hand, and then pull the other glove, the gloved hand, up over the glove that's turned inside out. And then that goes in the other glove and you dispose of it properly. Gowns, they provide protection from excessive blood splatter. Most everybody's wearing them with the COVID. May not be practical in some situations, but If these items are there for you to use and you don't use them and you get an exposure, you're not going to have a leg to stand on. So if you think you're going to need them, use them. Gloves, eye protection should be on every call that you go on. And when you're wearing eye protection, if you put it on top of your head, you don't need to worry about your hair getting infected. You need to worry about your eyes getting infected. Face shield provides protection from blood splatter. The only problem is you could still get blood because this is going up towards the forehead versus all the way down from the forehead down and keeping it all protected. Prescription glasses are not adequate. The goggles and face shields are best. Mask and respirators and barrier devices, very important and very critical at this time with COVID all around. Standard surgical masks for fluid splatter. Surgical mask onto the patient with any kind of communicable disease. You put a mask on them, you have a mask on yourself. Your mask goes on yourself first, then you put it on the patient. You may have a HEPA mask. If the virus is tuberculosis, now these HEPA masks, the one with the gentleman on the right, it is a form-fitting to his face. It's only used by him, and it has a disposable filter that is changed out after every time it's used. The one on the left, basically a disposable N95 mask, good for one use, and then it's disposed. Some other masks that are out there for mouth-to-mouth resuscitation, we use a pocket mask and then dispose of it based on local guidelines. To avoid the HIV and hepatitis, we're going to dispose of sharps properly. We dispose of them in an item that is approved, closed container. Every biohazard sharps container is red, and it will have some white on top of it so you can see where the needle goes in. You just drop it in. You don't push it down in there. You just drop it in, because you got to realize that any needle that has penetrated somebody's skin is now potential for exposure. So infection control will be part of your daily routine. Clean the ambulance after each run and on a daily basis. Wipe it down. Cleaning needs to be done at the hospital whenever possible. And the term cleaning is simply the process of washing a soiled object with soap and water, hot soap and water. Disinfecting includes cleaning, but also involves using a hospital-grade disinfectant or germicide to kill many of the microorganisms that may be on the surface. Sterilization is a process by which the object is subject to a chemical or physical substance, autoclaving, and it kills all organisms that could come in contact with the patient's skin. We don't do as much sterilizing. Most of the equipment that we use in EMS field is one use only, and then it is disposed of properly. Immunity. You may have immunity. Even if germs reach you, you may not become infected. You take preventative measures to become immune to it. You maintain your personal health. You receive your vaccinations. But if you are exposed to a patient's blood or bodily fluids, immediately turn your care over to another EMS provider. Clean the exposed wound, rinse eyes if necessary, and activate your department's infection control plan. It's not an option. If you have an exposure, you have to report it. Stress in EMS is very high, and it's important to know how it's caused and how to deal with it. You know, it's normal to get stressed when you get a call, the alarm goes off, but you have to be able to control it. But some of the physiological signs of stress: increased respirations and heartbeat, increase in the blood pressure, cool, clammy skin, dilated pupils, tense muscles, increased blood glucose levels, and some of the general adaptation syndromes, alarm response to stress, that's normal. And any of those items that I mentioned beforehand can happen with this. There's reaction and resistance to adapting to stress. It could be as easy as recovery quickly to exhaustion. Some stressful situations, dangerous situations, physical and psychological demands, critically ill or injured patients. Where that really comes into play a lot of times is if you're dealing with, especially with children, that puts a lot of stress on EMS personnel because they may have a child the same age. They may have the child, and the child they're dealing with reminds them of their own child, or maybe the child that they're dealing with has on a same shirt that your child has. It really increases the stress. And another reason in EMS that our stress level goes up, especially dealing with children, is we don't make as many calls on children as we do on adults. So a lot of EMS people don't ever feel comfortable dealing with the child. Dead and dying patients, overpowering sights, smells, and sounds. Pretty sure most everybody doesn't like to smell poop, doesn't like to smell pee, doesn't like to smell puke. Blood has a smell to it. So there is some stuff out there. Multiple patients, mass casualty incidents, angry, upset patients, family, and bystanders, unpredictability, demands of EMS, having an overabundance of non-critical 911 calls. We have acute stress reactions, meaning they come on suddenly during the stressful situation. Hopefully you know how to deal with that. Delayed stress reactions manifest themselves tenfold sometimes after stressful events. And then cumulative stress reactions, prolonged or excessive stresses. Doing the same thing over and over again, thinking you're going to get different results. PTSD, that can develop. Critical incident stress management was developed to decrease likelihood of PTSD. Nowadays, when we have critical type calls, we do a small PTSD management on the scene of the call after it's been taken care of course. And you don't just stop and talk about it, but afterwards, talk about what went right and what went wrong on the call with your partner driving back to the station after a call. That's one way of dealing with the stress. Here's a whole list of warning signs of stress. Irritability towards co-workers, family, friends. Sleep difficulties, sadness, anxiety, indecisiveness. Recreational drug use. There's a lot of warning signs. There's some physical symptoms such as chronic pain, headache, backache, the feeling of hopelessness, feeling that you just can't do anything right in the job. Every time you turn around, you've got a patient that is critical or dying or dead. Here's some ways of strategies to manage stress. Some of them we can do, some of them we can't. Changing work hours is kind of hard, and the work environment. Yeah, you can cut back on overtime. But one of the things we're afraid to do is talk about our feelings. We're afraid to seek professional counseling if needed. Every business has an EAP, an employee assistance program. If you need help, it's there for you. Take advantage of it. In this business, sometimes we have a habit of maybe not eating the most nutritious food, but you need to think about good nutrition, exercise, relaxation, trying to get sleep, regular and interrupted. Now, it's kind of hard in this business, but if you're off for your 2 days, that's when you need to look at getting regular uninterrupted sleep. Some wellness and stress management. Know your family health history. Adjust your lifestyle. Balance work, family, and health. Take time off. Do something away from your normal business. Think about cultural diversity on the job, workplace issues. Everybody's different. There's no two ways about that. But you got to communicate respectfully. Learn how to relate to people from different cultures. Don't be judgmental. Think about even learning another language. Sexual harassment, I know you need to know this. There's two types. Quid pro quo, requesting of sexual favors, or having a hostile work environment, joking around, touching, etc. Then be male to female, male to male, female to female, vice versa. Be very, very careful, because it doesn't take a lot for sexual harassment to be reported. So the quid pro quo and the hostile work environment, those are the two types. Most complaints are the hostile work environment, the jokes, the touching, etc. Be very careful about your social media. and then report harassments to a supervisor immediately. Keep notes. If you feel you're being sexually harassed, substance abuse, we talked a little bit about that. Think about if you're having a problem with it, the EAP, they're often available, Employee Assistance Program. Sometimes you're going to have some emotional aspects, your personal reactions to difficult situations. You have to deal with these feelings and know what to do. You're going to see death and you're going to see dying on this job. It can be quite sudden or after prolonged illness. You're going to face death. You're going to see man's inhumanity to man. You're going to see stuff that the normal person does not see. There's five stages of grieving: denial, anger, hostility, bargaining, depression, and acceptance. Not everybody goes through the 5 steps of grieving with death and dying of a loved one. Some people can go straight to acceptance. This isn't in any certain order. These are the stages. So your role is ask that person how you can help. But you also need to reinforce reality and be honest. But you also need to allow the patient, family to grieve. And not be judgmental. You're going to care for critically ill and injured patients. Let that patient know what you're going to do before you do something. Let the patient know that you're attending to his or her immediate needs. When you're caring for that critically injured or ill patient, watch what you say. Avoid the sad, grim comments. Ooh, man, that really looks bad. That doesn't work. Watch what you say. Tell the patient what you're going to do before you do it. Be honest. If it's going to hurt, tell them. You need to deal with the possible initial refusal of care. Know the different types of consents. You can allow for hope, but don't lie. You can tell the patient we're doing everything possible for your loved one. It's not unusual for the family to be in a room when there's a CPR going on. As long as they're not acting out, they can stay. If they start acting out, that changes the whole situation. You may have to locate and notify family members. If you have a child, ask one of the parents to accompany you with the injured and critically ill child. The death of a child, it's a tragic event. Not only do you have the death of the child, now you have the parent that you have to deal with also. Help the family any way you can. Ask them what they would like you to do for them to help. A lot of situations are stressful for everyone. Use care in your words and actions. Your job's to bring a sense of order and stability to the situation. The professional, they called you. Patients' reactions can be reflected by many, many different factors. Sometimes with a patient, it's best to just let them talk and you listen. I always try to transport parents with their children. And there are some uncertain situations, such as if an unclear and true medical emergency really exists. You might have to contact medical control about the need to transport. Patient doesn't want to go. But when in doubt, transport. Scene safety. Remember, we start our scene safety and being safe as soon as we are en route to the scene. Hazardous materials. Identify what you can. The Emergency Response Guidebook that you see on the screen, 2008, there's a 2020 book out now. It'll let you know everything you need to do about a hazardous material when you can find the number. It might tell you need to back up 2 miles. That means you need to get yourself out of there, but you got to get all the people that are around there out for 2 miles. Be careful with electricity. You're going to be out in the scene, on scene sometimes when there's lightning. Be very careful. Some scene hazards, fire, including smoke, oxygen deficiency, high temperature. Use proper protection. You're going to be out on vehicle collisions. There's a lot of factors involved. Unstable vehicles, traffic. You are not helping traffic because you're stopping traffic because you're trying to be safe to take care of a patient, and you're interrupting their drive. And they get a little upset sometimes. Think about the sharp objects, all the metal, all the twisted wreckage, down power lines. Make sure you have the right equipment. Protective clothing, and trying to prevent injury. It's critical to personal safety. Think about having cold weather gear. When it's cold, make sure you have a jacket, maybe a pair of gloves. Some other protective clothing, gloves, heat, cold, cuts, helmets, help you from falling objects, boots, steel-toed boots or a composite-toed boot or shoe is preferred in this business. Eye protection. If you have to wear prescription glasses, you should try to get eye shields on the side. But any eye protection should have shields on the side. Ear protection, skin protection, sunblock. What if you're out on the scene for an extended operation and it's 100, 105 and clear skies? Liable to get burnt. Body armor. It's getting more prevalent in the EMS and fire service. Think about violent situations, civil disturbances. They're becoming common. Domestic disputes, crime scenes, large gatherings. Know who's in command. Protect yourself. Don't disturb crime scenes. In behavioral emergencies that don't have a clear physical cause. It could be from hypoglycemia or head trauma. Both of those can result in aberrant behavior. Use caution on behavioral emergencies. Do they have a past history of behavioral problems? Think about their posture. Are they tense, rigid? Are they vocal, loud, yelling, screaming? Or physically active? Are they pacing back and forth? So that's the end of chapter 2, EMS, health and safety.